everyone. Welcome to the dialogue series organized by the Global Commission on Drug Policy in collaboration with the International Network of People Who Use Drugs. Today, I have the pleasure to welcome the Malaysian activist Yatie Jonet. Yatie has a long history of drug use and has been incarcerated multiple times for drug possession. She has over 9 years experience in harm reduction, and she's currently working on a project to empower transgenders and women who use drugs. And Anand Grover, member of the Global Commission. Mr. Grover is a senior advocate in India's Supreme Court. Between 2008 and 2014, he was the UN Special Rapporteur on the rights to health. Thank you both for being here with us today. Please, Yatie, the floor is yours.
The first question is, of course, around strategies in advocating government towards decriminalizations of drug use and decarceration of people who use drugs. What are the main key strategies to move forward with it?
There's no straightforward answer, but basically we have to explain through advocacy strategies to the government. And I know the Malaysian government last year was thinking of changing its laws. So you have an ideal opportunity. Criminalization has actually failed. It is increasing the number of drug users over a period of time in millions. But the most important thing is that criminalization actually targets not the drug trafficker, but the mere user who has some small amount of quantities of drugs, and it leads to mass incarceration in prisons. And the world over, we can say roughly more than 50% of the people in jail are because of drug-related offenses. So the basic point is, I think, a rational argument that it doesn't work and it does not work in any country is a good argument you can use. On the other hand, you can say that decriminalization actually works. And one of the very good examples that we use in the Global Commission is that of Portugal, because there people are not being put into jail, so they are not becoming criminals. So as a result, offenses there were reduced by more than half. People were less criminals, less overcrowding. And most importantly, a person was treated with dignity and respect. So if you just put these two against each other, you can see what works. And on top of it, you're saving so much money.
I've been in that punitive systems for the last 20 years.
Well, I'm also a drug user in the sense I drink alcohol every day. I keep it under control. I've never got drunk. But the most important thing is when a person is consuming drugs, they may become dependent on it and therefore they need help, and help is not forthcoming. That's where you need to develop infrastructure to support.
It's not easy. I can sense
it's not
that.
easy. I mean, when we started working on HIV, we were losers. For 10 years, we were losers. And it took us from 1988, I can tell you, to 2018. It's a long time. So you will get there, and you have a fortunate thing that the government was thinking last year in Malaysia of changing the law and changing policy.
What did you see this COVID as an opportunity, as the pathway towards decarcerations of people who use drugs in prison or detention centers?
Well, as we know, COVID is a bad thing that's happened all over the world. At the same time, paradoxically, it actually gives an opportunity, an excellent opportunity to release prisoners. In fact, you won't be surprised that in India, the Supreme Court passed an order saying, because COVID is transmitted very easily, to release prisoners who were serving sentences or offenses with imprisonment of less than 7 years. In Myanmar, the government passed an order and they released 25,000 prisoners, which is 1/3 of their prison population. So you can give these examples saying that in Asia it's happened.
You know that in Southeast Asia and especially Malaysia, there is a critical need to guide our society to view drug use from different angle. I've been doing it personally for over 5 years and it's hard. It's quite frustrating, but I'm not going to give up now.
Because you should never give up. That's the road to success.
Thank you, Mr. Anand, for the great chat that we have. It's really, really helps in this post-COVID era, and I will use your advice accordingly to advocate, to strongly advocate for decarceration of people who use drugs in my country.
Well, it's a pleasure, Yatie, talking to you and being in conversation with you. Thank you very much.
Thank you, Anand. Thank you, Yatie, for being with us today. And thank you all for watching, and watch out for the next videos.